Population health management is helping identify patients at high risk of health problems.
I was told it was in relation to my health, and quickly, because I've got a bit of a twisted sense of humour, I thought to myself, God, I'm that bad. I'm in that bad a state. I better go along then.
Patients at risk of heart failure in inner city Bristol visited a Healthy Hearts group to get support from a range of clinical and non-clinical services.
As part of the National PHM Development Programme, we brought together a wide range of organisations to look at linked data that showed us that heart failure had a high impact on emergency admissions for the patient and the NHS. What we did with these patients is we looked at what interventions we had and resources we had in our PCN and how we could target these resources to these patients who are high risk and most needed them. That included making sure that routine health checks were up to date, making sure they were eligible for any referrals to existing health services to support their health. And we also offered them all a referral to a social prescribing link worker so that they could be offered interventions that might help them beyond healthcare. And finally, we developed a Healthy Heart group to try and offer peer support and health promotion.
So part of the programme today, I discussed what body mass index meant. So we took everyone's weight and height and worked out the body mass index. So trying to explain to them in a very positive way what that actually meant. Weight has such an emotional connection for people, so it was really about breaking down those barriers and making that achievable.
I think in the Healthy Hearts group it's a really good group for social prescribing because they can access local community exercise groups, low-cost exercise at local community centres, and we also have a social prescribing physical activities coordinator who has a range of low-cost activities and groups that people can get together and motivate each other to do more exercise.
Often the NHS works is this one shoe fits all, and sometimes we need to think outside of these boxes and think about the ways that maybe these particular group are not accessing health, and there might be barriers towards why they're not accessing support groups, or maybe they're not eating the right food, or maybe they're not taking the right advice from the dietitian or the GP. It could be a cultural thing, it could be because of the areas where they live, socioeconomic. It's about increasing that trust and also kind of increasing health literacy among certain communities that may not understand things perhaps that are easy for other people for whatever barriers that are in the way.
Today was relevant to me in that I found out about the physio, which I think I'll require. The social prescriber, because I've got some issues that I think would be appropriate for her to help me with. The dietitian, because I have lost quite a bit of weight, but I still need to lose some more.
This PHM approach can help with lots of other areas as well. So for example with Caafi, to find those high-risk patients that most need our interventions.
Find out how you can use population health management by joining the free PHM Academy on the Future NHS platform.